sole. The lower limb, the leg is divided into several compartments. This is the cross section of the leg. As you can see here, this is the tibia and this bone here is the fibula. And this is the interosseous membrane which is connecting both the tibia and the fibula. The leg is divided into three compartments. This is the anterior compartment, this is the lateral compartment, and these two are the posterior compartment. First, we will discuss about the anterior compartment. So this anterior compartment is also called as the extensor compartment. The nerve of this compartment is the deep peroneal nerve. The deep peroneal nerve, as you know by nerve, it is the branch of common peroneal nerve, which in turn is a branch of sciatic nerve. The artery of this compartment is anterior tibial artery. And you all know by now that the anterior tibial artery is a branch of popliteal artery, which in turn is a continuation of the femoral artery. So having said this, we will discuss about the anterior compartment muscles. So we come to the muscles of the anterior compartment. As you all can see here, this is the anterior compartment of the leg, also called as the extensor compartment. The muscle you are seeing here, which is in close proximity to the tibia, this muscle is called as tibialis anterior. Now, as you can see, there is one more muscle called as tibialis posterior, which is on the posterior aspect of the leg. Now, this is called tibialis anterior because it is placed in the anterior aspect. So, one muscle we learned by now is the tibialis anterior. And next to that, one more muscle, what you're seeing here, as you can see, it is giving 4 tendons here. So, this muscle belongs to the extensor compartment. That is why it is called as extensor. And it is giving tendons to the lateral 4 toes. That is why it is called digitorum. And it's a long muscle. That is why it is called as longus. So this muscle, it is the extensor digitorum longus. So we have already discussed 2 muscles of this compartment. The muscle peeping in between the tibialis anterior, the extensor digitorum longus, this muscle, that muscle is called as extensor hallucis longus. It is called extensor because it's in the extensor compartment. It is called as hallucis because, as you can see, the tendon is attaching to the hallux or the great toe. That is why it is called extensor hallucis longus. And one more muscle is called peroneus tertius. The tendon what you are seeing here, that is the tendon of the muscle peroneus tertius. It is said that this peroneus tertius, it is a continuation of extensor digitorum longus. So these 4 muscles are the muscles of the anterior compartment of the leg. To sum up very quickly, we will see that the muscles of the anterior compartment of the leg are, so this is the tibialis anterior, which is in close proximity with the tibia, and this muscle is extensor digitorum longus. In between the 2 muscles is the extensor hallucis longus, and then we have this tendon that is the peroneus tertius. So in the anterior compartment of the leg, we know the names of the muscles. We know the nerve supply of this compartment is the deep peroneal nerve. We also know that the arterial supply is from anterior tibial artery. Now let us see individual muscles. Before that, the nerve supply of the anterior compartment is deep peroneal nerve. You can see here the nerve here, which is winding. This bone is the fibula and this is the tibia. So the nerve which winds the lateral aspect of the neck of the fibula, this is the common peroneal nerve. So this nerve, as you can see, it is dividing into 2 nerves. This is the superficial peroneal nerve and this is the deep peroneal nerve. The deep peroneal nerve is entering the anterior compartment of the leg. There is a superficial peroneal nerve that innervates the lateral compartment of the leg. Now the artery what you are seeing here, that is the anterior tibial artery, which is nothing but it's a branch of popliteal artery. Now we will just discuss the names of the bones present in the foot. Later we will go to the attachment of the muscles. So this is the skeleton of the foot and this is the dorsal aspect. The bone you're seeing here, this is the trochlea, this is the calcaneum, and what you're seeing here, this is the navicular bone. This boat-shaped bone is called as, this is the talus. So this is the talus, this is the calcaneum, and this boat-shaped bone is called as the navicular bone, and this bone is the cuboid. I'll repeat it once again. These three bones are called as cuneiform bones. This is the medial aspect. Medial cuneiform, intermediate cuneiform, lateral cuneiform. These are the metatarsal and these are the phalanges. So we will quickly revise the bones of the foot once again. So this bone, what you're seeing here, that is the talus. This is the calcaneum. This board-shaped bone is called as navicular bone. This is the cuboid bone. These three are the cuneiform. Medial cuneiform, intermediate cuneiform, lateral cuneiform, and these are the metatarsal. First metatarsal, second metatarsal, third, fourth, and the fifth metatarsal. This is the base of the metatarsal and this is the head of the metatarsal, and these are the phalanx. These are the phalanx. As you can see, this is the distal phalanx, this is the middle phalanx, and this is the proximal phalanx. So now we will go to individual muscles of the anterior compartment. As already discussed, we were discussing about the tibialis anterior. As you can see, this is the tibia and this is the fibula. The origin of the tibialis anterior is from the lateral aspect of the upper two-thirds of the tibia. The origin is not asked so far, but just listen in case asked. Now this muscle, it forms a tendon, and if you see, it is attaching. This bone is called as metatarsal. As already discussed, this is the head of the metatarsal and this is the base of the metatarsal. If you can see here, the tendon is attaching to inferior-medial aspect of the first metatarsal. This is the plantar aspect. So this is the first metatarsal. So this tibialis anterior is attaching to the inferior-medial aspect. It is attaching to the inferior-medial aspect of the base of the first metatarsal. So here is the attachment. It also attaches to the medial cuneiform. So that is about the tibialis anterior. So how does it take its origin from? Lateral surface of the upper two-thirds of the tibia. Its tendon is attaching to the inferior-medial aspect. So it is attaching to the inferior-medial aspect of the base of the first metatarsal. Along with that, it is also attaching to the medial cuneiform bone. So having discussed about the origin and insertion of the tibialis anterior, let us see the function of this muscle. So this action of lifting the dorsum of the foot towards our side is called as dorsiflexion, whereas this action is known as the plantar flexion. The function of this tibialis anterior muscle, it brings about dorsiflexion at the ankle joint. So that is the function of the tibialis anterior muscle. One more function is, it is also helps in inversion. Now what is inversion? When both the soles face each other, that action is called as inversion. When the sole face away from each other, that is called as eversion. Now a tibialis anterior muscle will help in inversion. So tibialis anterior, we have said that it helps in the dorsiflexion of the foot of the ankle. It also helps in inversion. Now we will come to the next muscle, which is the extensor digitorum longus. As you have already discussed, that this muscle gives 4 tendons to the lateral 4 toes. Now the origin of this is, it arises from the medial surface of the shaft of the fibula. It is not asked so far. It also arises from the lateral condyle of the tibia. Then what happens? This muscle forms a tendon. It passes down and it divides into 4 tendons for the lateral 4 toes. and it attaches to the base of the terminal phalanx. We will discuss about this with shortly. So what happens? This what you're seeing is that is the tendon of extensor digitorum longus. Now what thickening you're seeing here, that is called as superior extensor retinacula. It is nothing but a thickening of the deep fascia. You have one more thickening here which is Y-shaped. So this thickening is called as inferior, it's actually inferior extensor retinaculum. So superior extensor retinaculum, Y-shaped inferior extensor retinaculum. The function of this modified deep fascia is that it sees to it that the tendons are placed in, they are prevented from buckling from each other. They are secured in their place properly. Now, as you're seeing the tendon of the extensor digitorum longus, it is splitting into tendons for the lateral four toes. Now you can see one more thing here. The muscle which is placed beneath the tendon of extensor digitorum longus, this muscle is called as extensor digitorum brevis. So the muscle which is beneath the extensor digitorum longus is called as extensor digitorum brevis. If you see properly, this extensor digitorum brevis, it is giving tendons. It is giving three tendons, and these three tendons are attaching laterally to the tendon of extensor digitorum longus. So this is the tendon of extensor digitorum longus, and this is the tendon of extensor digitorum brevis. It's very easy to remember the name. Extensor digitorum brevis means small. Extensor digitorum longus means the long muscle. Now, once this extensor digitorum brevis joins the tendon of extensor digitorum longus, it forms a hood here. You can see a hood formation here, and that is called as dorsal digital expansion. So after forming the dorsal distal expansion, what happens is it divides into three slips, the middle slip and the two collateral slips. The middle slip is attached to the base of the middle phalanx, whereas the terminal phalanx is attached, the collateral slips are attached to the base of the terminal phalanx. I'll explain it in the next slide. So as already discussed, the four tendons of extensor digitorum longus. These are the tendons of extensor digitorum longus. They are joined laterally by tendon of extensor digitorum brevis. So once they are joined, they will form a hood here that is known as dorsal digital expansion, and the tendon splits into three, middle and two collateral ligament. The middle ligament attaches to the base of the middle phalanx, whereas the collateral attaches to the base of the distal or the terminal phalanx, and thereby it forms dorsal digital expansion. It is to this dorsal distal expansion the lumbrical and the interossei will be attached. So that is about the extensor digitorum longus. What is the function of this muscle? The function of this muscle is it brings about dorsiflexion of the lateral four toes. Now we will see another muscle. So far we have already discussed tibialis anterior. We have already discussed extensor digitorum longus. Now we will discuss extensor hallucis longus. So this muscle, it arises from the medial surface of the fibula. This is the fibula. After arising, it forms a tendon, and this tendon, as you all can see, it is attaching to the base of the terminal phalanx. It is attaching to the base of the terminal phalanx. The function of this muscle is that it brings about dorsiflexion of the first toe. So that is about the extensor hallucis longus. Now, we will quickly revise the muscles. So the tendon here, which is attaching to inferior-medial aspect of the first metatarsal, that tendon is called as tibialis anterior, as already discussed. Now another tendon here, sorry, tibialis anterior is this one. So the tendon here attaching here, this is the tibialis anterior to the inferior-medial aspect of the base of the first metatarsal. Now this tendon here, which is attaching to the base of the terminal phalanx, is called as extensor, hallucis, longus. This tendon, muscle which is forming four tendons, that is called as extensor, digitorum longus, and this fifth tendon is called as peroneus tertius. So this peroneus tertius, it is a detached part of the extensor digitorum longus. So that was about the anterior group of muscles. They mainly bring about dorsiflexion at the ankle joint. Now we will see about the nerve supply of this compartment. As already discussed, common peroneal nerve's branch is nothing but this deep peroneal nerve. So how does this deep peroneal nerve enter the anterior compartment? It pierces. This is an MCQ question. Please pay attention. Students, am I audible? Okay, we will discuss the class. So the deep peroneal nerve pierces in order to enter the anterior compartment. It pierces to a muscle. This muscle is called as extensor digitorum longus. So this is an MCQ question. Please pay attention. So now the deep peroneal nerve is in the anterior compartment in between extensor digitorum longus and the extensor hallucis longus. This is the MCQ question. Now we have the anterior tibial artery, which is nothing but a branch of the popliteal artery. Now this was to show that the sciatic nerve in the popliteal region, it divides into common peroneal nerve and the tibial nerve. The tibial nerve will innervate the flexor aspect of the leg, whereas common peroneal nerve, it will divide into superficial and deep peroneal. Superficial nerve will innervate the lateral compartment. Deep peroneal nerve will innervate the anterior compartment. Now we will see how the anterior tibial artery will reach the anterior aspect of the or the extensor aspect of the leg. So if you can see here, this is a posterior aspect of the femur, posterior aspect of the tibia and fibula. The muscle in green, what you're seeing here, that is tibialis posterior. Do not get confused with the muscle we just now saw. That was tibialis anterior. This is the posterior aspect. We have put the slide to see how the anterior tibial artery, which is a branch of popliteal artery, will enter the anterior aspect or the extensor compartment of the leg. So, in the popliteal fossa, we have the popliteal artery. This popliteal artery will divide into two branches, that is posterior tibial artery and the anterior tibial artery. So, this tibialis posterior, in between the two heads, there is a gap here. Anterior tibial artery will pass through this gap. It will pass through this interosseous membrane. So from posterior aspect, the popliteal artery will divide into posterior tibial, anterior tibial. Anterior tibial artery will enter this space and it will reach the anterior aspect of the leg. So this is how anterior tibial artery, which is a branch of the popliteal artery, will reach the extensor compartment of the leg. Now, we will see dorsum of the foot. Many MCQ questions are asked in this. So, in the dorsum of the foot, we will see that as already discussed. This is the superior extensor retinaculum and this is the inferior extensor retinaculum. There's an MCQ question on this, so please pay attention. So the attachment of the superior extensor retinaculum, as already discussed, it keeps the tendons secure. Now, it is attached to the anterior border of the fibula and it is attached to the anterior border of the tibia, just above the medial malleolus. So, this is about the superior extensor retinaculum. Now, if you see the inferior extensor retinaculum, what is that? It's nothing but the modification of the deep fascia. This inferior extensor retinaculum, it is Y-shaped. This is an MCQ question. So it is Y-shaped, as you all can appreciate. It is in the shape of a Y. This is the stem of the inferior extensor retinaculum. This is the upper limb and this is the lower limb. So this is the stem, this is the upper limb and this is the lower limb. Now the stem is attached to calcaneum. You just already saw the bones of the foot. So the stem will be attached to the calcaneum. The upper limb is attached to the medial malleolus. The lower limb, it continues and merges with the plantar aponeurosis of the foot. So this is an MCQ question. They have asked about the inferior extensor retinaculum, that it is Y-shaped. The stem is attached to the calcaneum. The upper limb is attached to the medial malleolus. The lower limb is attached, it merges with the plantar aponeurosis. Now, since we're discussing about the dorsum of the foot, we will quickly discuss the tendons we have already studied. So the tendon here, which is the tendon of the extensor compartment of the leg, which is attaching to the base inferior-medial aspect of the first metatarsal, this tendon is tibialis anterior. Another tendon here, which is attaching to the base of the terminal phalanx, this is extensor, hallucis, longus. As you all can see here, the anterior tibial nerve and the anterior tibial artery are entering here. This is the anterior tibial nerve and this is the dorsalis pedis artery. So we will discuss about this in detail. Now the anterior tibial artery, once it crosses the two malleolus, the medial malleolus and the lateral malleolus, it continues as the dorsalis pedis artery. This is very important in order to feel the pulsation in patients suffering from the vaso-occlusive diseases. So, the anterior tibial artery, once it passes between the two malleolus, it continues as the dorsalis pedis artery. We will discuss about it in detail. You have already seen by now that the four tendons here, what you are seeing, these are the tendons of extensor digitorum longus, and this muscle here, that is the extensor digitorum brevis. Now, this is a very important MCQ question which is asked several times. So, they have asked the innervation of the dorsum of the foot. So, what we can see here is there are several nerves innervating the dorsum of the foot. Now, here the nerve what you are seeing is the superficial peroneal nerve. This superficial peroneal nerve, as you all know, it is a branch of the common peroneal nerve, which in turn is a branch of the sciatic nerve. Now, superficial peroneal nerve, you already know by now that is innervates the lateral compartment of the lower limb. Now, the superficial peroneal nerve, it becomes cutaneous in the lower third of the leg. It pierces the deep fascia and becomes cutaneous. Later, once it reaches the ankle, it divides into two branches, one medial branch and one lateral branch. The medial branch will supply the medial aspect of the great toe, and another branch of the medial branch will supply the cleft between the second and the third toe. The lateral branch will supply the cleft between third and the fourth toe and fourth and the fifth toe. So, most of the dorsum of the foot is innervated by superficial peroneal nerve. It's a very important MCQ question. You all can see here, this is asked several times. Deep peroneal nerve, which is nothing but the nerve of the anterior compartment of the leg. This innervates the cleft between the first toe and the second toe. So this innervates the cleft between first toe and the second toe. So this is an MCQ question. They will ask the supply of the deep peroneal nerve in the dorsum of the foot. Your answer for that will be the deep peroneal nerve supplies the cleft between the first toe and the second toe. Majority of the dorsum of the foot is supplied by superficial peroneal nerve. Now, the lateral aspect of the dorsum of the foot along the little toe is supplied by sural nerve, whereas the medial aspect of the dorsum of the foot up to the base of the first metatarsal is supplied by the saphenous nerve, which is a branch of femoral nerve. So this is very important MCQ question. As you all can see, majority of the dorsum of the foot is supplied by superficial peroneal nerve. Deep peroneal nerve supplies the cleft between the first and the second toe. The lateral aspect of the dorsum of the foot is supplied by The sural nerve, saphenous nerve supplies the medial aspect of the dorsum up to the base of the first metatarsal. Now, again the same. So the medial aspect of the dorsum of the foot up to the base of the first metatarsal is supplied by the saphenous nerve. It is supplied by saphenous. Majority is supplied, dorsum of the foot is supplied by superficial peroneal nerve. And a part of the lateral aspect of the dorsum of the foot is supplied by the sural nerve. And this very important MCQ is the cleft between the first and the second toe is supplied by the deep peroneal nerve. Now we will see one more important thing. So we have already seen that the anterior tibial artery in between the two malleolus, it continues as the dorsalis pedis artery. So what this dorsalis pedis artery does is, it dips into the first dorsal interossei and it goes to the plantar aspect. It joins with the lateral plantar artery, This is the dorsalis pedis artery coming from the dorsum of the foot, piercing the first dorsal interossei. It comes to the sole and anastomoses with the lateral plantar artery. Now this is again an MCQ question. Where do you palpate the dorsalis pedis artery? This is the dorsalis pedis artery. You will palpate this artery in between the tendon of extensor, HALLUCIS longus, and the first tendon of extensor digitorum longus. So this is where you palpate the dorsalis pedis artery. Now we will answer the MCQ question. Students, are you all there? Is anyone there?
Yes, ma'am.
Yes, very good. So, the medial aspect of the great toe is supplied by, you know that the dorsum of the foot was supplied by some nerves, right? The medial aspect of the great toe is supplied by saphenous nerve, deep peroneal nerve, superficial peroneal nerve, sural nerve. What is the answer, student?
C.
Superficial peroneal nerve?
Superficial peroneal.
Any other answers, students? Any other guesses? Make mistakes, no problem. Any other guesses? I will tell you. The medial aspect of the great toe was supplied by saphenous nerve, right? Saphenous nerve. C. Yes, correct. Correct, students. Your answer is correct. The medial aspect of the great toe is supplied by superficial peroneal nerve. Now you will tell me what is the supply of saphenous nerve. How much does it supply, saphenous nerve? The medial aspect of the dorsum, up to the base of the first metatarsal. Excellent. Now, deep peroneal nerve, what did it supply?
Cleft between first and
Excellent. Majority was supplied by superficial peroneal nerve. Sural nerve, what did it supply?
Lateral aspect of the window.
The lateral. Excellent. Yes. Now, your answer is correct. The deep peroneal nerve sensory innervation, you just said me, first web space, fifth web space, anterolateral dorsum of the foot, lateral part of the leg. What's the answer?
First web space.
Excellent. First web space, or the cleft between the first and the second toe, is also called as the first web space. A person is unable to dorsiflex the foot and there is loss of sensation on the dorsum of the foot. Possible nerve injury is damage to common peroneal nerve at the neck of the fibula, damage to common peroneal nerve at the medial malleolus, compression of the anterior tibial nerve at the ankle, damage to superficial peroneal nerve, damage to deep peroneal nerve. What's the answer, students? Any idea? I will explain. Now, what happens is, if this is the fibula, we just said that the lateral aspect of the head of the neck of the fibula, the common peroneal nerve divided into superficial peroneal nerve and the deep peroneal nerve. This region of common peroneal nerve at the neck of the fibula is very vulnerable for injury because it is very superficially placed. So, in case of any fracture or something like that, the damage to common peroneal nerve at the neck of the fibula is very likely. So the answer for that will be damage to common peroneal nerve at the neck of the fibula. It is very unlikely for common peroneal nerve to divide at the medial malleolus because it's already divided at the neck of the fibula. Compression of the anterior tibial nerve at the ankle, very unlikely. So the answer for this will be damage to common peroneal nerve at the neck of the fibula. Clear, students?
Yes, ma'am.
Okay, pa. Anterior compartment of leg contains all muscles except peroneus brevis, peroneus tertius, extensor hallucis longus, tibialis anterior.
Ma'am,
Peroneus
first,
brevis.
Peroneus brevis. Yes, excellent. So because anterior compartment muscle, name the muscles. You have tibialis anterior, you have extensor hallucis longus, you have extensor digitorum longus, peroneus tertius. This muscle, it's a muscle of the lateral compartment. We have not yet discussed. We will discuss it later. So the answer is this is not a muscle of the anterior compartment, whereas this is a muscle of the lateral compartment. Peroneus longus and peroneus brevis are the muscles of lateral compartment. Action of tibialis anterior, plantar flexion of foot, adduction of foot, inversion of foot, none of the above.
Plantar flexion.
ma'am, inversion.
Inversion of the
Any other
foot.
answer? Yes. What happens is, now tibialis anterior is a muscle of the anterior compartment of the leg or the extensor compartment. Its action is dorsiflexion at the ankle joint and inversion. What is the meaning of inversion? If your two soles look into each other or they face each other, that is called as inversion. And tibialis anterior helps in inversion as well as dorsiflexion. Plantar flexion is brought about by flexor compartment of the leg, which is in the posterior aspect. So we will discuss about that later. So that is the answer of this question. All are true about the anterior compartment of the leg except tibialis anterior causes dorsiflexion of the foot. Extensor hallucis causes extension of the metatarsophalangeal joint of the big toe. Peroneus longus causes eversion of foot. Nerve supply of the anterior compartment is by the deep peroneal nerve. What is your answer, students? All are true about the anterior compartment of the leg except. So what they are asking is about the anterior compartment. Excellent, excellent. Peroneus longus, we just now studied, it's not a muscle of anterior compartment. It's a muscle of lateral compartment, right? Tibialis anterior causes dorsal flexion of the dorsiflexion. Excellent, correct. Then extensor hallucis longus, this is also correct. Nerve supply is through deep peroneal nerve, correct. Peroneus longus is the muscle of the lateral compartment. So that is the option. Now, not true about the inferior extensor retinacula. So not true about the inferior extensor retinacula. It is Y-shaped. The superior slip is attached to lower end of fibula. Inferior slip is attached to the deep fascia of the plantar aponeurosis. Laterally attached to calcaneum. What is the answer?
B.
D. I will explain once again. Any other options, students? Yes, I will explain this. You all know that the inferior extensor retinaculum, it is Y-shaped. This is the stem of the inferior extensor retinaculum, which is attached to the calcaneum laterally. The superior slip was attached to the medial malleolus of the tibia, right? And inferior slip was attached to the deep fascia of the sole, which is nothing but the plantar aponeurosis. So what is your answer now?
B.
Yes, answer is B. The superior slip is not attached to lower end of fibula, but it is attached to the medial malleolus of the tibia. This is the superior slip. So the wrong answer is superior slip attached to the lower end of the fibula. Understood, students?
Yes, ma'am.
Yes, yes. Now, neurovascular bundle of the anterior compartment of the leg passes in between the tendon of tibialis anterior, extensor hallucis longus, extensor digitorum longus, extensor hallucis longus peroneus tertius, extensor digitorum longus and peroneus tertius. Guess the answer, students?
Option B.
Yes, yes. So what we studied, the deep peroneal nerve, common peroneal nerve divided into superficial and the deep peroneal nerve. Deep peroneal nerve pierced the extensor digitorum longus, and it was in between extensor digitorum longus and the extensor hallucis longus. So your option is B. Between the extensor hallucis longus and the extensor digitorum longus. Now we have finished the lateral compartment. Now we'll study the lateral. We have finished the anterior compartment. Now we will study about the lateral compartment. Students, anterior compartment. Quickly, can you name some muscles of that?
Tibialis anterior,
Anterior, then
extensor digitorum longus,
extensor. Very good. Then
extensor hallucis longus,
extensor hallucis longus
and
and
peroneus tertius.
very good, very good. Peroneus tertius. What was the nerve supply of this? Nerve supply of the anterior compartment.
Deep
Deep
peroneal nerve,
peroneal nerve.
Very good. Artery supply was
anterior tibial artery.
excellent. Can you remember which was that muscle which formed the dorsal distal expansion? Yeah, that was extensor digitorum longus. It formed the dorsal digital expansion. Now we will study about the lateral compartment. It's very simple. Am I audible, students?
Yes, ma'am.
Okay, fine. So now we will discuss about the lateral compartment. There are two muscles in lateral compartment, peroneus longus and peroneus brevis. It is very simple. The nerve supply of this compartment is by superficial peroneal nerve, which is a branch of common peroneal nerve, which in turn is a branch of the sciatic nerve. Now the artery of this compartment is peroneal artery, which is a branch of posterior tibial artery. We will see about that later. Now the muscles as already discussed, this muscle here, that is the peroneus longus, and the small muscle here, that is the peroneus brevis. Brevis means small, longus means long. Because it is in the peroneal compartment, it's called as the peroneus. Okay. Now, so the two muscles are peroneus longus and peroneus brevis. If you see here, these two tendons, they are the tendon of peroneus longus and brevis. The nerve supplies by superficial peroneal nerve. So we will see how the superficial peroneal nerve will enter the lateral compartment. This is the common peroneal nerve. At the neck of the fibula laterally divides into superficial peroneal nerve and the deep peroneal nerve. So this is the superficial peroneal nerve. So it enters the lateral compartment and it passes in between the muscle which is peroneus longus and brevis. Then what happens is it becomes cutaneous in the lower third of the leg. We will see that shortly. So what you are seeing now, this is the superficial peroneal nerve which has become cutaneous in the lower third of the leg. As already discussed, superficial peroneal nerve has medial branch and the lateral branch. You know how it supplies the dorsum of the foot. Now, so that was about, this is about the superficial peroneal nerve. Now again, this is to show you that the common peroneal nerve, once it crosses the neck of the fibula, divides into superficial peroneal nerve, deep peroneal nerve. Superficial peroneal nerve passes in between peroneus longus and then peroneus brevis. It comes down. It becomes cutaneous at the lower third of the leg and divides into lateral branch and the medial branch and supplies the dorsum of the foot, majority of the dorsum of the foot. Now this is the peroneus longus muscle, peroneus brevis muscle. Now let us see the insertion of these muscles. So the peroneus longus, first we will discuss the peroneus brevis. This muscle, what you are seeing here, that muscle passes beneath the lateral malleolus, then it comes all the way and attaches to the tuberosity of the fifth metatarsal bone. So peroneus brevis is attaching to the tuberosity of the fifth metatarsal bone, that is the base. Now what happens to peroneus longus? This tendon is laterally placed, lateral to peroneus brevis, and it is going towards the sole. We will see that as it is going, this is the peroneus longus, as it is going to the sole, this is the cuboid bone. So you can see a groove on the inferior aspect of the cuboid. So the peroneus longus is passing in the groove on the inferior aspect of the cuboid, and it is attaching to inferolateral aspect of the base of the first metatarsal. Can you all say me which muscle was attached to the inferomedial aspect of the base of the first metatarsal, students? Am I audible? Yes, tibialis
Tibialis
anterior. Very good. Tibialis anterior was attached to inferior medial aspect of the base of the first metatarsal. Whereas peroneus longus, it is passing through the groove of the cuboid and it is coming and attaching to the inferolateral aspect of the base of the first metatarsal. So with this, we have discussed the two muscles. Now, what is the function of peroneus longus is, brings about eversion. It brings about eversion. Eversion means your two soles are facing away from each other. Okay. And the peroneus brevis, this also is an everter of foot. It brings about eversion of the foot. The nerve supply is, you already know by now, it is by superficial peroneal nerve. This is to show you that peroneus longus, how it grooves the cuboid bone and goes and attaches to the inferolateral aspect of the first metatarsal and also the cuneiform bone. Now again, this one MCQ question is asked on this. Peroneus brevis is attached to the tuberosity of the fifth metatarsal. Now, the two tendons, peroneus longus and peroneus brevis, they are passing between the peroneal retinacula. Again, the function of this is superior peroneal retinacula, inferior peroneal retinacula. The function of this is to see that the tendons are placed in position and to prevent their bowstringing. Again, this is a peroneus brevis, peroneus longus. Peroneus brevis is attached to the tuberosity of the fifth metatarsal. Peroneus longus is going all the way down to get attached to the inferolateral aspect of the first metatarsal's base. So, the function of peroneus longus and brevis is eversion, not inversion. It is eversion. Eversion means the sole is facing away. Two soles are facing away from each other. Now, let us answer the question, students. Injury to the common peroneal nerve at the lateral aspect of the head of the fibula results in all of the following except weakness of ankle dorsiflexion, foot drop, loss of ankle reflex, sensory impairment of lateral aspect of the leg extending to the dorsum of the foot. Any idea, students? Make some guesses. Any idea, students?
C, ma'am.
Okay, I will explain this. See, excellent, excellent. I will explain this once again. The injury of common peroneal nerve, if this is the neck of the fibula, common peroneal nerve injury at the head or neck of the fibula. Okay, so it divides into superficial peroneal nerve, deep peroneal nerve, right? Injury to common peroneal nerve at the lateral aspect of the head of the fibula results in all of the following except. Now, we just now studied that the deep peroneal nerve, which is a branch of common peroneal nerve, it innervated the anterior compartment of the leg and brought about dorsiflexion. So if common peroneal nerve is affected, obviously dorsiflexion is affected. If what happens if there is loss of dorsiflexion, there will be foot drop. Okay, if there is loss of dorsiflexion, there is foot drop. Then obviously sensory impairment of lateral aspect of the leg extending to dorsum of the foot by superficial peroneal nerve. Now about this ankle reflex, this ankle reflex is brought about by muscles of the posterior compartment of the leg, which is called as flexor compartment. We will study about it very shortly. There are three muscles, namely gastrocnemius, soleus and plantaris. I will ask you in next few slides. These three muscles are called as triceps surae. So these muscles bring about plantar flexion and thereby the ankle reflex. So the answer is loss of ankle reflex. We will discuss it in the next slide. Violent inversion of the foot will result in avulsion of the tendon of the following muscle attached to the fifth metatarsal: peroneus brevis, peroneus longus, peroneus tertius, Extensor digitorum brevis. What's the answer, students? The
Peroneal
clue.
brevis.
Excellent, excellent. We studied several times. Peroneus brevis is attached to the tuberosity of the fifth metatarsal, right? So they're giving a hint to you here that this tendon is attached here. Which is that? So your answer will be Peroneus brevis because it is attached to the tuberosity of the fifth metatarsal. Features seen in common peroneal nerve injury: inversion, inability, loss of sensation of the sole, foot drop, loss of extension of the great toe, seen in fibular neck fracture. What is the answer, students? See here, the answer will be for that foot drop. Obviously, common peroneal nerve injury, we know that deep peroneal nerve brings about dorsiflexion of the foot. If that is injured, plantar flexion and the foot drop will occur. If there is, and also loss of extension of the great toe, which is done by the extensor HALLUCIS longus, that is also gone. And obviously, the common peroneal nerve, if it is injured near the neck of the fibula during fibular neck fracture. So these three are the answer. Any doubts, students?
Ma'am, why is inversion not an option, ma'am? Inversion will also be affected, no, ma'am?
No, see here, common peroneal nerve, inversion, see, mainly common peroneal nerve, there is the fibula which winds here. Superficial peroneal nerve, which innervates the peroneus longus and the peroneus brevis. These two are the everters, right? Now the deep peroneal nerve, it innervates tibialis anterior. It brings about inversion. So eversion and plantar. Inversion, 1 second. Feature seen in common peroneal nerve injury. Loss of sensation of sole, obviously it is not the answer because it is by tibial nerve. Actually, inversion can be, students, because tibialis anterior is also causing the inversion, which is applied by the deep peroneal nerve. So this also can be a answer. This can be answer, students. Any doubts with that?
No, ma'am.
Okay, pa. So very good. It can bring about inversion as well because the deep peroneal nerve innervates the tibialis anterior whose function is inversion. So next we will see peroneus longus. So peroneus longus, inverter of foot, supplied by deep peroneal nerve, maintains the arches of foot, arises from tibia. What is the answer, students? Peroneus longus. This is inverter or reverter?
Everter.
Everter. Peroneus longus is supplied by
Superficial peroneal.
very good. Superficial peroneal nerve. Does it arise from tibia? It arises from fibula. It actually maintains the arch of the foot. What is the arch of the foot? Our foot, it has two arches, medial arch and the lateral longitudinal arch. So peroneus longus, it maintains the lateral longitudinal arch. So the answer will be maintains the arches of the foot. So with this, we come to the posterior compartment. As you all can see here, this is the posterior compartment. Students, any doubts so far? Is it clear? Anterior compartment and lateral compartment, students? Dorsum of the foot?
Yes, ma'am.
Okay. So now we will study the posterior compartment. As you all can see here, the posterior compartment is divided into two aspects by a transverse fascia, which is the superficial compartment, and the deep compartment. So we will study both of them first. So this is the posterior compartment. This entire thing is the posterior compartment. The nerve of this compartment is tibial nerve, and the artery is posterior tibial artery. So we will see that First, we will see the superficial plane muscles. The superficial plane muscles are gastrocnemius. So this reflected part is called as the gastrocnemius. And this sole-shaped muscle is called as soleus. This muscle here is called as plantaris. And we have already discussed about the triceps surae here. So the superficial muscles are three muscles. This is the gastrocnemius, this is the soleus, and this is the plantaris. All the three muscles joined together, they are called as triceps surae. This is the MCQ question. This is the MCQ question, so please pay attention. Now, the gastrocnemius, it has two heads. This is the medial head of the gastrocnemius, and this is the lateral head of the gastrocnemius. The lateral head of the gastrocnemius is accompanied by one more muscle, which is the plantaris. Now, what happens is the gastrocnemius muscle joins with the muscle underneath here, which is the soleus, gastrocnemius and soleus, and it forms a triceps surae. Below it forms a tendon, and this tendon is called as Achilles tendon. So this is the Achilles tendon, which is inserted into the middle 1/3 of the posterior aspect of the calcaneum. This is the MCQ question, students. So triceps surae means what muscles you will be saying?
Gastrocnemius, soleus, and
Gastrocnemius,
plantaris.
soleus, and plantaris. Very good. Okay. Now, so we discussed that the two heads of the gastrocnemius and the soleus, they join together to form the Achilles tendon, and it is inserted into the middle 1/3 of the calcaneum. Now, what happens to the plantaris tendon? The plantaris tendon, it attaches to the medial aspect of the stendoachilles, Achilles tendon. I will show you in the slide next. So what you can see here, so this is a cut aspect of the gastrocnemius muscle. This sole-shaped muscle is called as soleus. This is the tendon of plantaris, which is attached to the medial aspect of the Achilles tendon. Achilles tendon is attached to the middle 1/3 of the calcaneum. Now, yes, this is the attachment. This is the calcaneum bone, which the Achilles tendon is attached to the middle 1/3 of the calcaneum. Now we will go to the deep muscles, but before that, we will just see the gastrocnemius. Yes, the importance of soleus is, it is also called as peripheral heart. It is also called as peripheral heart. That is because, now what happens is, we have studied in varicose vein that the perforating veins will pierce this muscle, and it will communicate the veins. So the contraction of the soleus helps to push the blood to the heart. That is why it is called as peripheral heart. There is so much venous sinuses in this. So contraction of the soleus helps in pumping the blood. That's why it's called as peripheral heart. Now the nerves, now we will come to the deep compartment. So what we discussed so far was the superficial compartment. We discussed about the triceps surae. Now we will come to the deep compartment. In deep compartment, this muscle in the center, that is called as tibialis posterior, and this muscle medially, it is called as flexor. All this is flexor compartment, flexor, digitorum longus, and this muscle is called as flexor hallucis longus. So these are the three muscles, and the nerve supply of this compartment is tibial nerve, which is in turn a branch of the sciatic nerve. So you have the tibialis anterior, flexor digitorum longus, and flexor hallucis longus. Now, yes, these are the three muscles. Tibialis posterior, very easy because it's placed on the posterior aspect. That's why it's called tibialis posterior. Flexor digitorum longus, it is in the flexor compartment. That is why flexor. Digitorum, because it gives 4 digits. We will discuss about that later. Longus, it's a long muscle. Flexor hallucis longus, it is in the flexor compartment. So flexor hallucis, because it goes to the great toe, long muscle, that's why longus. And popliteus, this muscle is the popliteus muscle. So these are the muscles of the posterior compartment, the deep plane. Now we will discuss very, very important MCQ question. This is the tibialis posterior muscle. we will see the origin insertion of this muscle. So this muscle arises from, this is the posterior aspect of the tibia and the posterior aspect of the fibula. This line here is called as the soleal line. This is called as soleal line. So below the soleal line, a vertical line divides it into two parts. This is lateral and this is medial. So tibialis posterior arises from the lateral aspect on the posterior surface of the tibia. It also arises from the upper, this is an MCQ question, upper two-thirds of the interosseous membrane. It also arises from the deep fascia. Okay. Now that is about the tibialis posterior. Let us see its insertion. Now what happens to the tibialis posterior is, it comes and attaches to the tuberosity of the navicular bone. It attaches to the tuberosity of the navicular bone. This is the calcaneum and this is the talus. So a shelf-like projection here is called as sustentaculum tali. Sustentaculum tali. If you see here, tibialis posterior tendon is passing medial to the sustentaculum tali and it is attaching to the tuberosity of the navicular bone. As it attaches to the tuberosity of the navicular bone, it sends one more slip to the sustentaculum tali. It sends so many slips to the various metatarsal except the talus. We will discuss that. This is a MCQ question. So as you all can see here, the tibialis posterior, after taking its origin, it is attached to the tuberosity of the navicular bone. After attaching, it is giving so many slips to so many metatarsals except the villi. Except is the talus and also the base of the first metatarsal and sometimes the fifth metatarsal. Except this, the tibialis posterior, it gives tendinous attachment to various other metatarsal bones. So the question will be, the tibialis posterior is inserted to all the metatarsals except, your answer will be except the talus, except the base of the first metatarsal and also sometimes the fifth metatarsal. This is see here, this is the tuberosity of the navicular bone. So once it attaches to the tuberosity of the navicular bone, it gives attachment to the sustentaculum tali, to the cuboid, the cuneiform, sorry, this is the cuboid, except the base of the first metatarsal and sometimes the fifth metatarsal. It gives attachment to all the metatarsal bones. Now the function of this is, it brings about the plantar flexion. It brings about the plantar flexion. And it also brings about the, so this is the tibialis posterior, it also brings about the inversion. So that is about the tibialis posterior. Now they are left out with two more muscles of the deep compartment, which is, what is the muscles of deep compartment, students? Muscles of deep compartment of the flexor aspect of the leg. Can you name them?
Tibialis posterior, flexor digitorum longus, flexor hallucis longus, and popliteus.
Excellent. Okay. Now, tibialis posterior insertion you already know by now. We will study about the flexor hallucis longus. Now, an MCQ question is asked on flexor hallucis longus is, you just studied about the sustentaculum tali. So, the tendon which passes below the sustentaculum tali, if this is the sustentaculum tali, the tendon passing below the sustentaculum tali is flexor hallucis longus and it attaches to the base of the terminal phalanx. Now we will discuss about the flexor digitorum longus. As you already know by now, it forms 4 tendons and gets inserted to the lateral 4 toes. Now this muscle is comparable to a muscle of the hand. Any idea, students? Any guesses which muscle? I will tell. Flexor hallucis longus is compared to the flexor digitorum profundus of the hand because it pierces just like flexor digitorum profundus, which pierces the flexor digitorum superficialis in hand and attaches to the terminal phalanx. The same is the flexor digitorum longus, which will pierce a muscle which is called as flexor digitorum brevis. We will discuss about that when we come to the sole. So, flexor digitorum longus is comparable to flexor digitorum profundus of the hand, and this flexor digitorum longus pierces the muscle of the sole, which is flexor digitorum brevis. We will see that in our next class. Next few slides. Now we will discuss very important MCQ question. This is the popliteus muscle. They will ask, so this arises from the lateral condyle of the femur. So after arising, what happens is, this is intracapsular. This is an MCQ question. Popliteus is intracapsular, which means that it is covered by the capsule of the knee joint. Then it comes and attaches above the soleal line in the posterior aspect of the tibia. This is for the attachment of the popliteus. Now the question is, the MCQ question asked here is, it is intracapsular origin is the first point. Next point is its action. The important action of popliteus is it unlocks the knee joint. Details of this we will study in the next class, but for now I will tell you what is meant by locking. Any idea, students, what is locking of knee joint? Okay. Yes, I will tell. Yes. When you stand properly, what happens is all the ligaments of the knee joint are very taut. That is because in final degree of extension, what happens is the medial condyle of femur rotates medially over the tibia and thereby locks the knee joint. Now, you are standing straight, you need to walk, you need to take a first step. So what you will do, you will bend, you will flex your knee joint. So in the initial degree of flexion, already the knee was locked in extension. So in flexion, what this popliteus does is, it pulls its attachment. Therefore, the medial condyle of the femur will move laterally over the tibia. That is known as unlocking. So this is an MCQ question. The very important action of popliteus is it unlocks the knee joint and it is intracapsular origin. Did you all understand, students? Should I explain once again?
Ma'am.
Yes, I will explain once again. This is a very important MCQ. Now see here, what happens is, when you're standing, your femur, your knee joint is in extension, right? On complete extension, what happens is the medial condyle of the tibia, it is actually little large compared to the lateral condyle. So what happens in complete extension is, now when you're standing, you should not fall, right? So what the knee joint does is, it makes all the ligaments tense. How does it do? It moves the medial condyle of the femur. It rotates the medial condyle of the femur medially over the tibia, which means that this is the medial condyle of the tibia. Medial condyle of the femur will rotate medially over the tibia. That is known as locking. Now your limb is locked. You cannot move. In order to move, you should unlock. How unlocking occurs? Opposite. Now this popliteus is pulling. This popliteus is pulling the lateral condyle. Therefore, what happens? The medial condyle, which had rotated medially to lock the knee, will move laterally to unlock the knee, so that you can flex your knee joint and you can walk forward. So that is the meaning of unlocking, which is brought about by popliteus. Did you understand, students? This once again in detail I'll be explaining in the next class. Did you understand? Okay. Okay. So now very important MCQ question, students. So this is the flexor retinaculum. We have studied about the extensor retinaculum. Now this is the flexor retinaculum, which extends from the medial malleolus to the calcaneum. Now, what are the tendons passing, structures passing inside this flexor retinaculum is very important question. There is a mnemonic for this that is called as Tom, Dick and Harry. That is called as Tom, Dick and Harry. We will see what it is. Now Tom stands for tibialis posterior tendon. So this is the tibialis posterior tendon. This is the flexor digitorum longus. D stands for flexor digitorum longus. A stands for artery, which is which artery? Posterior tibial artery. N stands for nerve, which is the tibial nerve. H stands for flexor hallucis longus. So the structures passing inside the flexor retinaculum. What are the structures? The mnemonics for that, it's Tom, Dick and Harry. So Tom means tibialis posterior. This is tibialis posterior. D stands for flexor digitorum longus. A stands for posterior tibial artery, and nerve is the tibial nerve, and then flexor hallucis longus. So these are the structure. MCQ question is asked on this. So this was to show you that the sciatic nerve dividing into tibial nerve and the common peroneal nerve. Tibial nerve is innervating the flexor aspect of the leg. So that is about this slide. Plantar flexion is brought about all these three muscles, all of these muscles. Plantaris, flexor hallucis longus, tibialis anterior, peroneus brevis and soleus. What is your answer, students? Yes, I will tell you. See, plantaris, soleus, gastrocnemius, they bring about plantar flexion. And also the flexor hallucis longus. Tibialis anterior. Tibialis anterior brings about dorsiflexion. Peroneus brevis, it brings about eversion. It brings about eversion of the foot. So the answer is plantaris, flexor hallucis longus and soleus. Any doubts, students? Did you all understand?
No, ma'am.
Yes.
Yes,
Now,
ma'am.
yes, tibial nerve injury causes. Tibial nerve injury causes dorsiflexion of the foot at the ankle joint, plantar flexion of the foot at the, Tibial nerve injury causes dorsiflexion of the foot at the ankle joint, plantar flexion of the foot at the ankle joint, loss of sensation of the dorsum of the foot, paralysis of muscles of the anterior compartment, loss of sensation over the medial border of the foot. What's the answer, students? I will explain this. See, tibial nerve injury. Tibial nerve supplies the posterior aspect of the leg, which brings about plantar flexion. If there is injury to this nerve, no plantar flexion will occur. Loss of sensation of the dorsum of the foot. Tibial nerve will not supply the dorsum of the foot. It supplies the sole. Paralysis of muscles of anterior compartment. Anterior compartment is supplied by the deep peroneal nerve. Loss of sensation of medial border of the foot. It's wrong because medial border of the foot is supplied by the saphenous nerve. So the answer is dorsiflexion. Now what happens is when tibial nerve is injured, plantar flexion cannot happen and therefore the foot is in the opposite, that is it is in the dorsiflexion at the ankle joint. Any doubts, students?
No, ma'am.
Yes. Now, following are the nerves and muscles of the leg, choose the correct pair. Superficial peroneal nerve supplying soleus, deep peroneal nerve supplying peroneus brevis, tibial nerve supplying tibialis anterior, common fibular nerve supplying short head of biceps.
Option D.
Yes, very good. Now, soleus is supplied by which nerve? Tibial nerve. Peroneus brevis is
Tibial
supplied
nerve.
by which nerve?
Superficial peroneal nerve.
Superficial peroneal.
Excellent. Tibialis anterior is supplied by which nerve?
Deep peroneal nerve.
Very good. Short head of biceps. Students, in last class we have discussed the biceps femoris is what type of muscle? Biceps femoris is a hybrid muscle. It has long head, it has short head. Long head is supplied by tibial nerve, short head is supplied by common peroneal nerve. So the answer is following are the nerves and so this is the answer. Which of the following tendons are most likely to rupture on violent dorsiflexion of foot? So what happens is, I will tell the answer for this. Now plantaris muscle, it arises from the femur. Which part of the femur? Lower third of the lateral supracondylar line of the femur, and it forms a tendon. The tendon is very fragile. So it is said that on violent dorsiflexion, the rupture of tendon which occurs is the plantaris. Now, muscles acting both on knee and the ankle joint. Gastrocnemius, soleus, plantaris, tibialis posterior, flexor hallucis longus. What is the question, answer, students? Muscles acting both at the knee and the ankle joints. For this muscle should have attachment both to the femur and the tibia. So which is that muscle? I will tell the answer. The muscle is gastrocnemius and plantaris because it has attachment both to the femur and the tibia. That is why it will act on both the knee and the ankle joints. So gastrocnemius and plantaris is the answer. All are true about popliteus except flexes the knee, unlocks the knee, inserted on medial menisci. It is intracapsular. What is the answer, students? All are true about popliteus except? Students, am I audible? I will tell the answer. Yes, I will tell the answer. The popliteus, it flexes the knee. As you all got to know, it unlocks the knee. It is intracapsular. This popliteus is attached to the lateral menisci, which we'll be discussing in our next class, not the medial menisci. So this is the option. So popliteus is not attached to medial meniscus, it is attached to the lateral menisci of the knee joint. Which of the following muscle is inserted in triceps urae, gastrocnemius, soleus, plantaris, tibialis posterior, flexor hallucis longus? What is the answer, students? Triceps
Plantaris.
urae. Yes, triceps urae means 3 muscles. Very good. Plantaris and 2 more muscles.
Soleus gastrocnemius.
Soleus and
Soleus
gastrocnemius.
gastrocnemius.
Excellent. Okay. Which muscle originates both from tibia, fibula, and interosseous membrane? It has to arise from tibia, fibula, interosseous membrane. Popliteus, tibialis posterior, flexor hallucis longus, flexor digitorum longus. It is tibialis posterior. See, popliteus arised from the lateral condyle of the femur and it attached to the tibia. It has no attachment to the fibula. Whereas we discussed about tibialis posterior, that it arised from tibia, it arised from interosseous membrane and also the fibula on the posterior aspect. So the answer will be tibialis posterior. Now, tibialis posterior is inserted to all the tarsal bone except calcaneus, cuneiform, cuboid, talus. What is the answer, students? Tibialis posterior is inserted to all the tarsal bones except. Excellent. Except the talus and also the first metatarsal. Yes. Now, structures passing deep to flexor retinaculum. What was the mnemonics? Tom, Dick, and Harry, right? So, what is your answer for this? Posterior tibial artery, long saphenous vein, tibialis anterior, peroneus tertius.
Tibialis anterior.
Yes. Posterior tibial artery is the answer for that. Which tendon passes below sustentaculum tali? We just discussed. Tibialis anterior, tibialis posterior, flexor hallucis longus, flexor digitorum longus.
Tibialis posterior.
Which tendon passes below sustentaculum tali? I will explain this, students. So, you have the sustentaculum tali of the calcaneus, right? The flexor hallucis longus passes below the sustentaculum tali, whereas tibialis posterior, It passed medial to the sustentaculum tali and it gave a tendinous slip to the sustentaculum tali. So your answer is flexor hallucis longus. So the answer is flexor hallucis longus. Which of the following tendon has attachment to sustentaculum tali? Now your answer is clear. Tibialis anterior, tibialis posterior.
Tibialis posterior.
Yes, very good. Tibialis posterior. Now we will very short, in few minutes we'll finish this class. We'll discuss about the sole. The immediately after removing the skin, what you see is the plantar aponeurosis. As you know, there are 4 layers in the sole. We will first, this MCQ questions have been asked on this. So first we will discuss about the first layer of sole. In first layer, you have 3 muscles, namely hallucis. The first toe is here, so hallucis. Abductor hallucis. Now for abduction to occur, the axis is drawn to the second toe. Movement away from it is abduction. Movement towards it is adduction. So this muscle is the abductor hallucis. Towards the little toe is abductor digiti minimi, and this is flexor digitorum brevis. So the 3 muscles, this is an MCQ question. They will ask the muscle and say which layer it belongs to. So in the first layer, you have the abductor hallucis. Abductor digiti minimi is to the last toe. And then you have flexor digitorum brevis. Students, you remember when we were discussing about the posterior compartment of the leg, what were the muscles present there? Tibialis posterior, flexor digitorum longus and flexor hallucis longus, right? We compared flexor digitorum longus to flexor digitorum profundus. Now, I will say you what is compared to the flexor digitorum superficialis of the hand. So, the flexor digitorum brevis, this muscle is compared to flexor digitorum superficialis of the hand because you can see here the tendon of flexor digitorum brevis is splitting and attaching to the middle phalanx, whereas the tendon of the posterior compartment of the leg, which is flexor digitorum longus, is it's passing in between and it is attaching to the base of the terminal phalanx. So the muscles are abductor hallucis, abductor digiti minimi, flexor digitorum brevis. So this is the first layer of sole. In the second layer, you have tendon of flexor digitorum longus we just discussed. This is the tendon of the flexor digitorum which pierces the flexor digitorum brevis and it is attaching to the base of the terminal phalanx. Now you can see here, these are the lumbricals which will arise from this tendon. The lumbrical arises from the tendon of flexor digitorum longus. Now, before it is inserting, another muscle attaches to this flexor digitorum longus and that muscle is called as quadratus planae, also called as flexor digitorum accessorius. So this is flexor digitorum accessorius and tendon of flexor hallucis longus. So this is the second layer of the muscle. Now, an MCQ question is asked. You have 4 lumbricals which arise from flexor digitorum longus. First, they are numbered from medial to lateral. First, second, third, and the fourth. Now, the first lumbrical is supplied by the medial plantar nerve, which is from the tibial nerve. The lateral plantar nerve, via the deep branch, it will supply second, third, and the fourth lumbricals. So the third layer, what you have, it is the flexor hallucis brevis. It is the flexor hallucis brevis, and then you have flexor digiti minimi brevis, and then you have one more muscle, which is the adductor hallucis, which has oblique head and the transverse head. This is not asked so far, and then you have these are the dorsal interossei. So this is about the sole. The first layer of sole has, what is the answer, students? The first layer of sole has?
Abductor hallucis.
Excellent, excellent. Flexor hallucis longus was a muscle of which compartment?
Posterior compartment.
Flexor hallucis brevis. and then you have the adduct. So the answer is the first one, first layer of sole. Now third and fourth lumbricals of the foot are supplied by, you have 1, 2, 3 and 4 lumbricals. So first lumbrical is supplied by medial plantar nerve. Second, third and fourth are supplied by the lateral plantar nerve. Now third and the fourth will be obviously supplied by the lateral plantar nerve. So this was about today's class, students. Did you all understand? Did you all follow the class, students?
Yes, ma'am.
Any doubts? Any doubts, students?
No, ma'am.
Ma'am,
Yeah,
I
any
have,
doubts? Kindly. Hello.
ma'am. Hello, ma'am.
Yes, pa. Yes, pa.
Ma'am,
Yes,
is the
you're audible.
base, ma'am, is the base of the toe and the ball of the great toe the same, ma'am?
For ball of the toe, see here, the base of the metatarsal. Don't get confused. See, you have metatarsal, right? You have 5 metatarsal, right? Now, the metatarsal, this is the base of the metatarsal, head of the metatarsal. What is the ball of the toe is, you have your first toe, right? The major weight bearing is the ball of the toe. Don't get confused with the base of the metatarsal. Ball of the toe is just underneath the toe. You have the pulp, the major bulk of the toe, that is the ball of the toe. Understood, pa?
Yes, ma'am. Thank you, ma'am.
Okay, pa. Thank you so much. Any doubts? Please mail me, students. I will answer your doubts. Thank you so much.
Thank you so much, madam. Thank you all.
Thank you, sir. Thank you so much.